Okay, Mom, I am Nika Concepcion, and this time I am going to demonstrate oxygen therapy. Okay, so the first procedure is to review the physician's order for oxygen to ensure that it includes methods of delivery, flow rate, and radiation rate. Second is to perform hand hygiene. So before entering this room, I already wash my hand. The next is you need to identify your patient. Okay, Mom, what's your name?
Junkie de la Linya,
How about your age, Mom?
19 years old.
Okay, Junkie de la Linya, 19 years old. The next is to provide your patient's privacy. Then, I'm going to proceed to the sixth right of the medication administration. So, okay, Mom, you have the sixth right of medication for administration. Right patient, right medication, right dose, right time, right route, and right documentation. Then, let's explain to the patient that oxygen will use dyspnea or discomfort and inform the patient concerning safety precautions associated with oxygen use. So, if the patient is using cannula, encourage him or her to breathe through nosomia. Okay, later, Mom, we will use nasal cannula. So, okay, Mom, I will assist you into the high fall nurse position. Okay, so my patient is in the semi-Fowler's position. After that is we are going to insert the flow meter into the wall outlet, then attach oxygen tubing to the nozzle on the flow meter. If using a high oxygen flow, attach humidifier, attach oxygen tubing for humidifier. So we are going to turn on the oxygen at the prescribed rate. Then we are going to check if the oxygen is flowing through the tubing. So we have in our tank, so our tank is where the oxygen is restored. We have our humidifier to prevent nasal cavity being dry if it is humidifies the flow of the oxygen. For the nasal cannula, first we are going to hold the nasal cannula in proper position, prongs used facing or curving downward. Then after that, we are going to place cannula prongs into the nearest of the patient, okay? Then we are going to wrap the tubing behind the patient's ear. Then after, we're going to adjust the plastic side under the chin until the cannula fits snugly to the patient. Then add tape as necessary. Okay, so we're down now using the nasal cannula. When using a mask for oxygen for the patient, first is we're going to place the mask on the face on the patient, applying from the nose and over the chin. Then we're going to adjust the metorium over the nose and contour the mask to the face. Then after that, we're going to adjust the elastic band around the head so the mask fits snugly to the patient. Okay, so we're done. After performing the nasal cannula and using mask to the patient, we're going to assess for proper functioning of the equipments, and we are going to observe patient initial response to the therapy, whether it is good to the patient or it causes bad effect to the patient. Then we're going to monitor continuous therapy by the pressure areas on the skin and nearest every 2 hours, and the checking flow rate every 4 to 8 hours. Then we are going to document the response to the oxygen therapy or the nasal cannula therapy. Then we are going to refer to the physician if we can observe abnormal findings throughout the procedure, acting after doing the nasal cannula and mask to the patients. Then we are going to perform the aftercare.